Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? From colic to constipation, sleep struggles, torticollis, plagiocephaly, tummy aches, all the different things leading into their older years of sensory struggles, ADHD, anxiety. The list is never ending with kids nowadays. What we are seeing today in offices all over the country is that the paperwork always has one common denominator. Moms will say, I was so stressed during my pregnancy. Or I had such a traumatic birth. I remember the doctor having to pull the baby out so hard. They had to do all these things to get the baby out. Other things we've heard are, I've lost a loved one while pregnant, or this is my rainbow baby after having numerous miscarriages, which is incredibly hard. Stress, 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 and more stress. So, how can we help ease this stress for both expecting mothers and babies nowadays so that we can prevent all these issues from happening? Obviously, we can't control everything that happens in life, but we can help the nervous system be able to work through and process all this trauma easier so that both mom and baby will be more adaptable and resilient to all things that life can bring, hoping to possibly avoid the common symptoms that we mentioned earlier that we see with babies after birth. If you're an expecting mom or want kids in the future, keep watching this video as we will talk to you about how you can start influencing your child's nervous system even before they're born. This video is for expectant parents, those planning to have babies in the future, families who want more babies, and anyone curious about birth and how to have the best pregnancy and help learn more about the development of the baby's nervous system. So we're going to dive deep into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system and their development within the utero. You're going to learn how the vagus nerve influences your baby's growth, why it matters for long-term health, and how you can support optimal development during your pregnancy and beyond. If you're a planner like me, this video is for you. At Pinnacle Chiropractic, we specialize in cases that involve birth trauma. Sweet babies who come in struggling with colic and eczema, sleep challenges, they're just not comfortable, they're arching. We also have toddlers and elementary age kiddos that suffer from these challenges as babies, and then they grow into other diagnoses like SPD, ADHD, OCD, ODD, and autism, which is super, super scary as a parent too. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles to begin with, a stressful pregnancy, or a traumatic birth, or sadly, all three. These three things are very likely, especially with how medicalized our country has become with prenatal care. So let's look at some stats to paint the final picture for you. America spends close to $100 billion on birth per year. 1 in 3 American women have a C-section. The WHO recommends 10 to 15% at most, and that's only when it's deemed a true medical emergency. So it's way more common nowadays to have a C-section or a surgical birth. 70 to 75% of American women receive an epidural. 31% of women are induced, and I actually think that number is higher now. 1 out of 7 American women experience a postpartum mood and anxiety disorder, which is incredibly hard on her and the family. The fertility market in 2022, $7.9 billion. And in 2028, it's projected to be $16.8 billion. It's only increasing. 65% of women are currently on hormonal birth control, and that includes teens. I am so grateful for emergency medicine in the US. We are number 1 in the world for emergency care, but unfortunately for maternal and infant outcomes, typically when it's not an emergency, it's being treated as an emergency. We actually rank dead last at 55% for maternal and infant outcomes. Again, not everything is in our control, but as a whole, something is not quite right here. Medical intervention is definitely needed in true emergency situations, but not everyone should turn out to be an emergency pregnancy and birth. For low-risk pregnancies, too much interference is happening. This is leading to a cascade of interventions and what we call the perfect storm in kids, which are all these common symptoms and diagnoses that we're seeing time and time again in our office. So how can we best prepare our mind and body for pregnancy and birth so that we can have the best outcome possible for both mom and baby? Let's go through 4 tips. Stick around because tip number 4 is going to be the most important. So tip number 1, empowering and knowledge about birth. So have you ever heard the saying, birth is 80% mental and 20% physical? When people told me this before having a baby, I never believed them. But after prepping for birth and studying for it, this is something that we're planning to achieve, our dream births. And that's when I believe it. 20% comes right at the end when you completely surrender to your body and let it do what it was meant to do. When you are more educated, you know more, and you can do the best you can. Number 2, tip, start to prepare even before conception. Now this is huge. This is for couples who know they want a baby in the future or ones who are going through fertility struggles. There is so much that you can do to prepare your body. We call this preconception work. It's doing all you can do to be the healthiest version of yourself. So if you attend our workshop, we get into more details on this, but at least 3 to 6 months before trying to conceive, start becoming the healthiest version of yourselves, both mom and dad, not just mom. A big misconception is that prenatal life is all on mom, but that is not true at all. The sperm actually builds the placenta. Mom and dad play an equal role, especially in preparing for conception and the fertility phase of everything. You are creating a baby that is half of you and half of your partner. Number 3, you need to find your circle. This is so important. Surround yourself with people who protect your vision for your birth. You want friends and family who are supportive of how you envision it all to go. And it's okay to build boundaries in this around yourself during this time and say that you just don't really want to hear about other people's birth stories if it's not going to be in a positive light. Hearing people's trauma isn't exactly reinforcing for you either. So the last tip, you need to find a provider that aligns with your vision and answers your questions for you. You should never feel belittled or irrelevant when you ask your questions. Your providers work for you, not the other way around. And finally, the most important one of them all, making sure that your nervous system is adaptable and resilient so that whatever life throws your way, you and your baby can process through it and not store that trauma in your body. But you can recognize that, process it, and then adapt accordingly. So let's break it down. Let's start with the most basic understanding. The nervous system controls every cell, organ, and tissue of mom and baby's bodies. A lot of the times, hormones get blamed for everything in pregnancy, from crying to mood swings to more serious topics such as fertility struggles and miscarriages. Doctors love to run the chemical imbalance of hormones. As this is true, and this is definitely an important component, is it really the root cause? Because what creates your hormones? What controls the release of your hormones? What system regulates hormones and decides which ones that are needed at specific times? The nervous system. There is our root cause. When the nervous system is dysregulated, many common symptoms occur. Things like cramps during your menstrual cycle or your period, increased symptoms from endometriosis and PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness and nausea, high blood pressure, constipation, whatever the symptoms are that come with this journey for you, we can almost always trace it back to your nervous system. So how can you check if your nervous system is ready to make a baby, have a great pregnancy, and conquer birth and postpartum? The first step is to measure your heart rate variability. So we do this here at Pinnacle Chiropractic using technology that is far more advanced than the Whoop, the Garmin, and Apple Watches and Oura Rings. We love those gadgets always for daily use, but this will tell us overall how your nervous system, in a gold standard way, is adapting to stress and your body's battery. Are you ready to take on the prenatal season? It is long and enduring, so is your body ready? This will always tell us as well how baby is adapting to stress. And whatever mom experiences, so will baby. So you really want to make sure that this HRV reading is as prime or as ideal as possible prior to conception. We're also going to do 2 other scans that will tell us even more about your nervous system. These two are also fast and non-invasive for you. They're going to tell us how well your brain is communicating with the rest of your body, where you're storing and holding your energy, and how your nervous system is processing and dealing with stressors like traumas and toxins in your life. So, the central nervous system is the biggest reproductive organ that we have. It controls all other organs and hormones, so we need it to be functioning at its best for preconception, pregnancy, and well after birth and postpartum. So if you want to see how your nervous system is handling things right now, and this is on the radar for you when you want to start your family or have another baby, please reach out to us so that we can help you measure that and prepare in the most optimal way, you and your partner, so that having a baby is the easiest possible journey for you and your body. So reach out to us today and let us know if we can help you.